And welcome to Focus on Health. I'm Joe Gum. Today we're joined by Dr. David Kim of Live Life Again Bariatric in Colleyville, Texas. Dr. Kim has been recognized by the American Society for Bariatric Surgery as a distinguished surgeon of excellence. His expertise in the various types of weight loss surgery allows Dr. Kim to customize a specific surgery to the patient's needs, and I'm sure they appreciate that. We certainly appreciate you joining us today to talk about this.
Thank you, Joe.
Now, there are several types of bariatric surgery that you perform. However, lapband seems to be the most popular of these surgeries. Why is that?
You're absolutely right, Joe. 70% of my patients will ultimately choose lapband surgery because it's the least invasive. We're not going to be cutting or stapling the stomach in any way. And I brought a prop here, if I may show it to our viewers, because I think it's going to exemplify exactly what the band is all about. Our stomach model is actually, the real stomach is bigger than this. I've always said it's the size of a football, but the shape is very much like this. And in a band operation, we're physically putting the band device around the top part of the stomach, much like a belt going around your waist. We're going to do that through small little incisions, inch-long incisions or so that you will not be able to see 6 months later. But through these minimally invasive techniques, we're able to basically convert this one stomach into two. The upper stomach, or what I call the pouch, and then the lower portion of the stomach. And the band then works like a kitchen funnel. When patients eat, the funnel and the narrowing that we purposely create will allow the food to slow down at the top part of the stomach, allow patients to feel full then because the pouch is full, and patients will eat far less food. Typically what you could comfortably fit in the palm of your hand, as opposed to eating much more than that. It's an adjustable device, and I think patients also appreciate that because this is not permanent. We're not permanently changing the shape of your stomach or re-altering the intestines. It is completely reversible, and we adjust it at the time of the office visits. We will place this port right underneath the skin. It is not visible, but by placing a small needle and running saline through here, the inner tube inside of this band is what becomes gently full of saline and creates that funnel. So that's where the slowing down effect occurs, Joe, and it's very effective in allowing people to lose weight.
Well, how do you determine how to squeeze the device and to make it smaller or larger? And when people say, hey, I want it smaller, I want the smallest you can be, you have to take caution in that, I guess, right?
Absolutely. That's a great question. This entire operation is intended as a reminder, a daily reminder to patients when they sit down and eat that, hey, I've had this surgery to eat differently. I'm going to be reminded then by the band that I'm getting full now with a small amount of food. And because of that adjustment is very important. We do that in the office under X-ray vision. We're actually going to be physically able to see that narrowing that we intend to occur by you swallowing some strawberry flavored barium. And so that funnel effect is what we're able to see, and we want that compromise where someone feels full, but if it's too tight, then everything will come up, and that's certainly not good. So we're going to be very cautious and allow that very happy medium where people feel full with a small amount of food and still allowing it to pass.
Well, good. Now, when it comes to post-surgery, talk about what you and your team and how you guys manage people's lives, because this is a big step.
It is absolutely a big step. We recognize it's been a lifelong illness, or several years for many people, and because it's a serious problem, it's not something that can be cured by a pill or some fad diet right away. We're really big into thinking about this as a tool to help you reconstruct your life. Behavioral changes, positive lifestyle changes, of fitting in daily exercise, and then the nutrition education that we're really big into, so you can select out more proper foods.
Well, thank you, Dr. Kim, for joining us today. Thank you for bringing the prompt. I know people appreciate that, and if you appreciate it as much as I do, and you're interested in a no-cost consultation, please call Dr. Kim's office today, 817-886-7822, to schedule your appointment, or for more information on the services offered, log on to the website on your screen right now. Live Life Again Bariatric Center paid for this segment. Thank you for joining us for this edition of Focus on Health. Have a great day. I'm Joe Gum.